Welcome to the Deep Dive, your shortcut to really getting to grips with complex topics. Today, we're diving into something pretty critical, often unseen, a battle happening inside the body. Multiple Organ Dysfunction Syndrome, MODS. Our bodies, they're amazing, really, so resilient. But there's a delicate balance, right? And under extreme stress, well, things can go wrong. MODS is what happens when that balance is just pushed too far. So in this deep dive, we're going to unpack what MODS actually is, how it develops, which is often quite tragically. We'll look at the challenges in predicting it, managing it, and why understanding it is so important for anyone interested in critical illness. All the information, all the insights we're sharing, they come straight from the source materials we studied. Okay, so let's get into it. Let's start right at the beginning. What is MODS exactly, and why is it such a huge concern? Well, simply put, the sources define MODS as altered organ function in someone who's acutely ill. It gets so bad that they need medical help, intervention, just to keep those organs working.
Exactly. And that phrase requires medical intervention is it's really crucial. It's not just a little dip in function. It's the
Yeah.
point where the body's own coping mechanisms, they're exhausted.
Yeah.
It needs like external life support. And our sources, they actually describe MODS as, another step, another phase in the progression of shock states. So it's a downstream problem, a complication when the body's struggling with blood flow.
And the numbers.
Yeah.
Wow. The numbers in the sources really paint a stark picture. Dysfunction in just one organ system, that's linked to a 20% mortality rate.
Yeah, 20%.
But then if you get more than 4 organs failing, the mortality jumps to at least 60%. I mean, that's terrifying.
It truly is. And what's so insightful there, I think, is how it shows the body's interconnectedness, right? It's not just additive risk. Failure in one area seems to multiply the vulnerability everywhere else. It's this profound systemic collapse, which is precisely why doctors and nurses in critical care are constantly working to prevent even that first organ from starting to fail.
Okay, so if it's that severe, that devastating, what actually causes it? How does the body spiral into this multi-organ crisis?
Yeah, that's kind of the million-dollar question, isn't it? Because the precise way MODS happens, it's still largely unknown. We just don't have all the pieces yet. What we do know is that we see it most often in patients with sepsis, that overwhelming body response to infection. It seems to boil down to inadequate tissue perfusion, basically. Cells and organs not getting enough oxygen because blood flow isn't good enough. And it often pops up towards the end stage of septic shock when, despite all efforts, blood flow just can't be effectively restored. This also makes it incredibly hard to predict. Like, you can have 2 patients in shock looking quite similar, but you can't say for sure which one will develop MODS. Part of the problem is that a lot of the initial damage, it's happening way down at the cellular level, microscopic. We can't directly see it or measure it easily.
Ah, okay. So that explains why the sources describe the clinical picture as insidious. It sort of creeps up on you rather than hitting like a truck.
Exactly. Insidious is the perfect word.
It's gradual, subtle, makes it tough to catch early. The tissues, they start getting starved of oxygen, nutrients at both the micro, the cellular, and the macro, the whole organ level. And eventually that starvation causes the organ to fail, meaning you need machines, ventilators, dialysis, or strong drugs to take over its job.
It's like trying to forecast a storm brewing inside the body. You see the clouds gathering the shock, the sepsis, but pinpointing exactly when and where the lightning will strike, which organ goes first, it's still a real challenge. Which, raises a big question for the clinical teams. If it's so tricky to predict and it starts so hidden, how do they even begin to anticipate it? Or is it always a bit of a reactive battle?
That's a great question. And I think that's where the real skill of critical care comes in. Because while it is insidious, there are patterns. There are things to watch for, these clinical manifestations that can be warning signs. Now, the exact order things happen can vary, yeah. Depends on the patient, their main illness, other health problems they have, comorbidities. But for clarity, the sources describe a sort of classic pattern that often unfolds. And this is where it gets really intense, watching how one system failing can trigger the next, like dominoes.
That's right. Typically, the lungs are often the first to show significant trouble. You'll see the patient getting progressively short of breath, heading towards respiratory failure. This often shows up as acute lung injury, ALI, or the more severe form, ARDS, acute respiratory distress syndrome. And that usually means they need intubation, a breathing tube, and a mechanical ventilator to breathe for them.
Wow, okay. Lungs first.
Yeah. But interestingly, at this early stage, their main vitals, like blood pressure, might look relatively stable, hemodynamically stable, we call it. But don't let that fool you. They often need more and more IV fluids and vasoactive drugs, powerful meds, just to keep that blood pressure and heart output steady. And even then, you start seeing signs of the body going into overdrive. A hypermetabolic state. It's like the engine is redlining.
Redlining. How do you see that?
Well, you see things like high blood sugar, hyperglycemia, too much lactic acid in the blood, hyperlactic acidemia, and increased BUN levels, which points towards kidney stress and how the body's handling protein. The metabolic rate, the speed at which the body is burning energy, can shoot up to 1.5, maybe even 2 times the normal resting rate. It's just frantic.
That sounds exhausting for the body.
It is. And this huge energy demand leads to a severe loss of muscle mass. It's called autocatalysis. The body literally starts breaking down its own muscle tissue to use as fuel. It's quite destructive. Then, usually after about, say, 7 to 10 days, if things haven't improved, you see the next wave hit. Signs of liver problems, hepatic dysfunction, things like high bilirubin, abnormal liver function tests, and kidney failure, renal dysfunction. You see rising creatinine levels, and maybe they stop making urine, which is called anuria.
So lungs, then liver and kidneys.
Typically, yes. And as this lack of good tissue perfusion continues, the blood system, the hematologic system, starts to falter too. This makes the immune system weaker, worsening immunocompromise, so they're incredibly vulnerable to more infections, and the risk of bleeding goes up. And then sort of in the later stages, the cardiovascular system, the heart and blood vessels, can become unstable, stops responding well to those powerful vasoactive drugs, and neurologically, the patient's responsiveness declines, sometimes progressing all the way to coma.
Gosh, it really is a cascade, isn't it? A clear, devastating progression. One system failure really does seem to pull down the next, creating this incredibly complex web of problems. So understanding that cascade, the next question has to be, how do medical teams figure out who's most at risk? And how do they track how severe things are getting?
Right, that's crucial because while, like we said, true prediction is still really tough, there are tools. Clinical severity assessment tools, they help clinicians sort of quantify the risk, estimate the likelihood of organ dysfunction, even mortality. These are things like Apache scores, SAPS, maybe PRO, and the SOFA score is a common one. They look at various physiological measures and chronic health factors to get an objective sense of how sick the patient is, how much organ support they need.
And the sources also point to specific risk factors, right? Things that make someone more vulnerable to developing MODS in the first place.
Absolutely.
Like advanced age seems to be a big one, primarily because older adults might have less sort of backup capacity in their organs, what we call physiologic reserve.
Yeah.
Plus, natural aging processes, maybe a weaker immune system.
Exactly. Age is definitely a factor.
And others mentioned are malnutrition, having other chronic illnesses already, like heart disease or diabetes, being immunosuppressed for other reasons, or having big surgical wounds or injuries from trauma, which can be entry points for infection and inflammation.
Yeah, all those things can lower the threshold, essentially. And recognizing those risk factors, connecting the dots, that's a vital first step for the clinical team. It helps them know who needs the absolute closest monitoring, even when the signs are still really subtle. It's all about trying to intervene early, trying to maybe head off that cascade before it really gets going.
Okay, so recognizing the risks, understanding the progression, that leads us to the fight itself. What are the key strategies? What's the game plan when facing MODS?
Well, the absolute #1 priority, stressed again and again in the sources, is prevention. Trying to stop MODS before it even starts is by far the best strategy.
Makes sense. An ounce of prevention.
Exactly. And that means things like, for older adults especially, really early detection of infections, picking up on those subtle changes, maybe just a slight confusion, a change in mentation, or a temperature that's slowly creeping up, not necessarily a high fever right away.
Yeah.
Those could be critical early warnings, documenting them, acting on them quickly.
But what if prevention isn't enough or it's too late? If MODS starts to develop, what are the main treatment approaches then?
Right. If prevention fails, the focus shifts. The sources lay out 4 main pillars of treatment. First, control the initiating event. You've got to tackle the root cause, whether it's sepsis, trauma, whatever, kick things off.
Okay, stop the trigger.
Second, promote adequate organ perfusion. Everything hinges on getting enough oxygen and blood flow to those struggling organs. So that means managing fluids, using those vasoactive drugs we mentioned, maybe other supportive measures.
Right, support the organs.
Third, provide nutritional support, aggressive nutritional support.
Nutrition, okay. And fourth?
Fourth, maximizing patient comfort. Pain management, sedation if needed, addressing anxiety. It's crucial for the patient's well-being and can actually impact their physiological stress levels too.
That nutritional support point, You mentioned it's vital. Why is that so critical, especially given what you said earlier about the body being in that hypermetabolic muscle-burning state?
Ah, good connection. It's critical because of that hypermetabolic state.
Yeah.
The body is burning through energy reserves at an alarming rate, including breaking down its own muscle, that autocatabolism.
Yeah.
You don't provide enough calories and protein externally through feeding tubes or IV nutrition, the body will just keep cannibalizing itself. So that nutritional support isn't just about feeding, it's about trying to slow down that self-destruction, giving the body the building blocks it needs to even attempt repair, and supporting the immune system. It's a fundamental part of trying to turn the tide.
Got it. It's about fueling the fight, essentially. And, we've been talking a lot about the medical side, the physiology, the treatments, but it feels important to also acknowledge the human side of this. MODS isn't just a diagnosis, it's a profound, often terrifying journey for the patient and their family.
Oh, absolutely. It's incredibly intense on a human level. The nursing role, for example, goes way beyond just the technical tasks. It's about constant support, monitoring minute changes, being that human connection for the patient when they're at their most vulnerable, and working tirelessly until that initial insult, that primary problem, starts to resolve. And supporting the family. That's huge. Providing clear information, being honest but compassionate, helping them navigate incredibly difficult decisions. Sometimes that includes conversations about end-of-life care, making sure that the treatments align with what the patient would actually want if those wishes are known.
That communication piece seems vital. The sources mention encouraging frequent, open communication about treatments, options, expectations, keeping everyone on the same page, respecting the patient's wishes.
Exactly. And that communication is just as important if the patient survives. Recovery from MODS. It's not flipping a switch. Remember that autocatabolism, the muscle loss, it's massive. So rehabilitation, as the sources describe it, is a long, slow process. Patients need to understand that. They need realistic goals and a lot of encouragement.
A marathon, not a sprint.
Precisely. And that's where a strong relationship with a healthcare team, especially nursing, built on trust and good communication, becomes so important. It provides that encouragement, that support during a really tough uphill battle to regain strength and function.
So pulling it all together, multiple organ dysfunction syndrome, it's clearly this complex, insidious, and incredibly severe consequence of acute illness. That cascading failure is just, it really highlights how interconnected and, I guess, fragile our internal systems can be under extreme duress.
It absolutely does. And it really hammers home the importance of prevention, the need for really vigilant early intervention if things start to go wrong, and acknowledging the very long and challenging road to recovery for those who do survive. Every single step, from catching that first subtle sign to the final stages of rehab, it all matters enormously.
So something to think about, maybe. Consider that incredible, often completely hidden battle for survival happening right down at the cellular level inside us during conditions like MODS. Think about the complexities, the challenges, and just how critical every single aspect of care truly is, from spotting trouble early right through to that long, slow journey back to health.